Hi, my name is Inga and I'm here to teach you pregnancy yoga. Pregnancy yoga is a fabulous way to prepare for the birth of your baby, this magical moment when everything will change. Through yogic asanas, we work on strengthening the spine, opening the hips and make them more flexible for labor. We also learn various breathing techniques, some of them to be used during labor to make contractions less painful and more effective. But the most beautiful way to prepare for your labor is to relax. And relaxation is a crucial part of pregnancy yoga. We say that birth is the state of your mind. So imagine if your mind is relaxed, if you're going to labor in this with the relaxed approach, how beautiful the labor is going to feel. So now I'm going to teach you a few poses to practice regularly, possibly every day, and prepare for your labor. So the most important pose to practice each day is the cat pose. So you're going to place your hands directly underneath the shoulders. Your knees are hip width apart. And please make sure that you're not sinking your lower spine. When you're pregnant, there is a lot of tension sometimes as a side effect of pregnancy in the lower spine. So try to take your spine under, lengthen on the in-breath, everything in a very soft way, and as you're breathing out, opening the spine. And on the in-breath, come back. So do practice this a few times a day, if you can. Your spine will be so happy. If you have any tension, it will be released. If you don't want to have any tension, as a prevention, it's a fabulous way to do it. And also baby is absolutely so happy in this position because it's being rocked. So if you want to go to sleep and the baby is very active, do a few cats and the baby will quiet down and go to sleep and you can have a restful night. Now this position also could be modified as everything. Modifications are really important when you're in labor. Modify everything which doesn't feel right. Everything what we do is absolutely safe. I'm specialized in pregnancy yoga, but sometimes if the baby is quite biggish or in the position where is pushing legs or hands in your belly, change the position. Everything can be modified. So now as you're breathing out, we're going to swooping cat breath, sitting on the heels, bending the elbows and coming back on the in-breath. So flowing with the movement. This is really important. When you're pregnant, you're just flowing. The fluidity, the softness is so crucial. So everything you do with your own limits. Never go above the limits. Never feel any pain. The only good pain in the body is the birthing pain, nothing else. And we do one more breath. And we're going to use this position for rotation. So now I'm going to turn around, so to show you the modification of the cat pose, taking the leg to the side. If it feels painful, by all means, bend. It's your practice, it's really personal. Make sure you feel comfortable. Palm of the hand up, and as you're breathing in, lift, opening the chest, creating more space for the baby, creating more space for your breath, opening intercostal muscles, tiny muscles between the ribs. If you wish, if you're more flexible, you can go a little bit deeper. Just listen to the needs of the body. Make sure that you're only rotating the upper spine. Modification of pregnant lady, the asanas for pregnant ladies, they are quite few because your body has different needs and it's really important to make sure that you modify the poses. So now taking the other leg to the other side, palm of the hand up, and as you're breathing in, left on the out breath, flowing with the movement. You can stay in the basic position. You can go a little bit deeper. It's really up to you. Just listen to the needs of you and the baby, because now practice is for both of you. And we're just going to do one more repetition. And the third pose which I want to show you now is Baddha Konasana. It's the pose which you could practice, or maybe you should practice, every day from the week 32. It's fabulous preparation for the hips. Bringing the feet together. If you feel that the spine doesn't want to stay still, or is not really comfortable, take your hands behind. So you're resting on your hands. You bring your bum a little bit closer And then you try to open the knees, bringing the knees closer. It's like a butterfly, you're flying. You're opening on the out breath, closing on the in breath. Opening on the out breath, closing on the in breath. Some of you probably, many of you, can sit comfortably with feet together. Some of you can open the feet like a book and close. Or you can check if your feet are clean and then you can close. So do whatever feels right, but do practice this one as a fabulous preparation for the hips. And the last one. And to make it a little bit stronger, open. So now we're going into Upavista Konasana. If you feel that the knees are painful, bend. Lift the softness of the bottom, sitting on your sitting bones, place your hands in front of you. And now imagine that the baby wants to rest on the floor. So you're hinging from the hips. Remember, all yogic forward bends are happening in the hips. You're hinging, the upper body is relaxed. So place your hands here. As you're breathing, you can imagine that you're lengthening, going all the way to the ceiling, lengthen the spine in a very soft way. And then on the out breath, you going down a little bit within your own personal limits. And then lift again. Just follow the needs of the body. Perhaps you can go a little bit deeper. Remember everything within your own limits. And the last one, perhaps you stay here. Doesn't really matter. Is the opening of the hips, lengthening the spine, the elbows directly underneath the shoulders. Some of you with small babies and flexible hips can maybe hold the pose a little bit deeper. Just relax into the pose. So it's really noticing your needs, you and the baby. And then after the last one, come back into sitting position, close your legs, and we're just adding a side bend very softly, hands touching the mat, lifting one arm and very softly going to one side, just flowing with the breath, flowing with the movement on the out breath. You can add rotation of the neck, you can look straight ahead, just really listen to your own body. This is what is going to happen in labor. If you listen to the body, needs of the body, the labor will feel different. Intuition, following the wisdom of your body, believing that you've got everything you need to give birth to the baby. And one of the aim of the yoga, pregnancy yoga, or my pregnancy yoga, is to make you to believe, to find this inner strength and believe that you do have everything to give birth to your baby. And after the last side bend, I would like you to sit maybe in Vajrasana if you can. If you can, stay in cross-legged position. Place one hand on your chest, one hand on your baby, and we're just going to notice the breath. The breath is the most important. You can be without food, water, few days, without the breath. And also, learning how to breathe properly is very crucial, especially now because you're breathing for you and the baby. You can work on the quality of your breathing. So notice which hand is moving. Is it the one here? So the chest, in and out, or is the hand on the belly moving on the in breath and the belly sinking on the out breath? So we want to learn the abdominal breathing. So place your hands on your belly and now imagine that you've got a big balloon underneath your chest, and as you're breathing in, you're opening, blowing the balloon through your nose. And then as you're breathing out, there is a tiny hole in the balloon and the breath is escaping either through the mouth, slowly, softly. And this is what we're going to use during labor to help contractions. And then as you're breathing in, again, allow the belly to open, the chest to rise, deep breathing within your limits, and on the out breath, breathing out through the slightly open mouth or through the nose, whatever your choice is today. So deep abdominal breathing. And this abdominal breathing will help you to go through labor. It's used intensively during the second stage. So practice abdominal breath as well. I hope that we're going to see each other at the normal yoga session online, pregnancy yoga, where I can teach you more asanas, where I can teach you more breathing techniques, more relaxation techniques, and more ways to prepare for your wonderful day. Thank you very much. Namaste.